Do I have a what?
A hard out where you have to.
Oh, I mean, around 9 o'clock or a little after is fine. I have a
Okay.
10 o'clock consultation. I just have to be on.
Perfect. Perfect. Okay. So we are live on Facebook and YouTube. We have the world expert on Lyme disease, but today we're going to talk about COVID-19 and his latest discoveries. So make sure you get on your phone or your computer and start sharing, start tagging, start doing all the things that will help increase the classroom. So fasten your seatbelt because Dr. Richard Horowitz is in the class. It's time to dance, Dr.
Not
Horowitz.
until the record button is
Oh,
hit.
not until the record button is hit. There we go. Let's do that again. No, I guess we can just do that. Here we go. Just go ahead. Now it's time to dance.
The Lillian McDermott Show.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be right here. Right here, and when you need a friend, you can count on me. I'll be right here, waiting for you.
This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening and viewing friends. It's so nice we can meet each other on the air on this beautiful, best day ever. And for those of you who are tuning in for the first time, because you know Dr. Horowitz is in the classroom, please know I've been waiting for you. This is a safe place where you can go to when you need a friend. It is my commitment to provide alternative ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you will feel empowered to embrace a new truth and live the life of your dreams. Now, as I was talking to Dr. Horowitz before we got in the class this morning, he is world-renowned expert on Lyme disease. And we know that there is certainly a lot of people suffering from Lyme disease. And so, yes, we're going to talk a little bit about that, but most everybody wants to know what's the latest, what's going on with COVID-19. And we have dedicated the last several months to learning everything, good, bad, ugly, spirit, mind, and body about coronavirus COVID-19. But Dr. Horowitz, he's the author of Why Can't I Get Better and How Can I Get Better, which is the copy that I do have, has not only dedicated himself to helping people improve and reverse Lyme disease, but to also figure out ways to do it naturally. He's done it all over the world. And so now he is looking at COVID-19 and the patients that he sees, that, by the way, a waiting list of over 400 people, that now you will be able to hear from Dr. Horowitz what is truly going on with COVID-19 and how we can get better. And since it is our sole purpose in life to give and receive love and knowledge, I'm so grateful that Dr. Horowitz is here to do just that. Welcome back, Dr. Horowitz, to the classroom.
Thank you, Lillian. It's great to be back again.
Yes, I am so looking forward to. I mean, you were in Washington helping the United States government trying to figure out to get a handle on this Lyme disease, and now you are looking at something totally different. Is COVID that much different than Lyme? Is that why you're able to make the connection?
So, what's interesting is that when I started reading the medical literature on COVID, of course, I wanted to understand if my patients got sick, what was the best way to be able to treat them. And I started reading about the inflammatory molecules. They're called cytokine storms. They're molecules that go into the body. They have special names like chemokines, cytokines. These are inflammatory molecules that create havoc in the body. It's like having a fire. So if it's a fire in the lungs, you might get COVID pneumonia, or you might get what they call ARDS, acute respiratory distress syndrome. If this inflammation hits the heart, it causes a myocarditis, a fulminant myocarditis, which just means inflammation of the heart muscle. If it hits the liver or kidneys, you can have liver problems, kidney problems. It's affecting the blood vessels. In children, they're now finding something called Kawasaki disease, where the blood vessels are being affected with inflammation. And the older people, as well as younger, even in 30s and 40s, are having strokes because there are clots that are forming from this hypercoagulable state that's happening from the virus. Now, all of this is from inflammation. So in my books, when I'm describing and why can I get better and how can I get better, I talk often with Lyme about the 3 I's: infection, inflammation, and immune dysfunction. Well, it turns out it's exactly the same thing in COVID. The infection is different. It's a virus, it's not a bacteria, but the inflammatory molecules that are coming out from COVID, it turns out they're the exact same inflammatory molecules we've seen with Lyme. So I just published a study. It was case reports in the Journal of Respiratory Medicine case reports. If people look it up online and they look up Horowitz, Richard, Journal of Respiratory Medicine case reports, it's on the efficacy of glutathione in treating shortness of breath with COVID-19 pneumonia. And these were 2 patients who both had tick-borne disorders. One still had active Lyme, another one had been treated successfully, and they developed the classical symptoms of COVID. They lost their sense of smell and or taste, which is a very early sign you get with COVID in about 88%. They had the cough, they had the shortness of breath, they had fevers, and they were on a regimen that Plaquenil and Zithromax that the French doctors had been kind of advising. This goes back about 6 weeks. We put them on a drug called Lillian. It's an antiviral. It's a very old drug. It's been around for quite a few years. And they were getting somewhat better, but really not that much better. And we decided to try glutathione. Now, glutathione is made by the liver. It's something natural that the body normally makes as one of the 6 pathways in the liver. And glutathione is the major antioxidant in the body. And when I did a literature search, we found out that in the lung tissue, in ARDS, acute respiratory distress syndrome, in bacterial and viral pneumonia, the glutathione levels were low. So we said, gee, that would be interesting to try giving these people glutathione. We gave them 2,000 milligrams orally, and within 1 hour, their shortness of breath was better.
Wow.
It was repeated again the next morning. They again got help. So I spoke to researchers yesterday. We plan on doing a randomized controlled trial, but it does look like the reason people are getting sick is this inflammatory response, and they don't have enough antioxidants like glutathione, one of the major antioxidants in the body, to protect the body from the ravages of the virus.
Interesting. Okay, so along with those lines, the cytokine storm, which comes first, the chicken or the egg? So I've heard that first, the exosomes find this intruder in the body, this virus that's trying to gobble it up and do what it now normally does. And so can you explain about a little bit more about exosomes in our body and what their functions are?
I mean, the way that normally I explain it to people is that the worst people with COVID, when the body starts attacking the virus, you have several different types of cells in your body that normally are needed to attack the virus. So these are usually the natural killer cells. They're a type of lymphocytes, T lymphocytes, and you also have macrophages. So the macrophages and natural killer cells, these are the cells normally that go after viruses. Now, you can check your level of natural killer cells. And in fact, I found some of my patients are deficient. So one of the supplements that I've been using for these people to raise natural killer cell function is 3,6-beta-glucan.
3,6
beta, B-E-T-A, glucan, G-L-U-C-A-N.
Okay.
These are another way of doing it is transfer factors, right? So that comes from colostrum. So these are the 2 things that normally will raise natural killer cell function in the body. So if you're someone and you don't know your immune status, and you don't know whether you'll be able to fight the virus, your doctor can check your natural killer cells. And again, we've been using that along with zinc and vitamin C, because zinc is necessary for these cells to fight the viruses properly. It lowers inflammation. Some of the researchers are believing that zinc is stopping the viral entry into some of the cells. So on the first line of defense, we're basically using 3,6-beta-glucan. We're using zinc 40 to 50 milligrams a day, and a gram or a gram and a half of vitamin C 2 or up to 3 times per day. So
Really,
what
that's
happens?
all? That's all of vitamin C, 1 gram?
Well, if they get pneumonia, then we increase the dose to like 6 grams, from like a gram 3 times a day to 2 grams 3 times per day. And the reason for this is that glutathione and vitamin C are both necessary antioxidants for the lung tissue. So again, if your lung tissue does not have enough antioxidants, and what they've shown is these macrophages, if they get overstimulated, there's something called macrophage activation syndrome. And this is not just the normal amount of cytokines of these inflammatory molecules, but a huge amount, a storm is coming out of these molecules. And if you don't have enough antioxidants, it's destroying the lung tissue, it's destroying the internal organs. So that's where these antioxidants are helpful. And there's 2 biochemical mechanisms, like 2 pathways in the body to block the inflammation. So the way you make glutathione is NAC, N-acetylcysteine. So you can get that from whey-based proteins. You could drink drinks with whey-based protein, assuming you're not allergic to dairy, right? Or you take NAC. So on the average, we use 600 milligrams of N-acetylcysteine twice a day. For someone who's really deficient in glutathione, that can go up to 1,200 milligrams twice a day. So that helps your body to make glutathione. We then give alpha lipoic acid. Alpha lipoic acid is a very powerful antioxidant. It is water soluble, it's fat soluble, it goes throughout the body, and it also helps to regenerate glutathione as you're using it up. And then we usually use glutathione, average 250 milligrams twice a day, 500 milligrams twice a day. But when you get COVID pneumonia, or you get a more severe complication of COVID, then you're going to want to use higher dose glutathione, like 2,000 milligrams all at once. And this can be done orally. It can be done by IV. One of my patients I reported in this study used it IV as well as oral and found the IV to be quite effective. So, if you're in the hospital and your loved one is on a ventilator, and they can't take oral very easily, they can use IV glutathione, and we plan on doing a randomized controlled trial. So NAC, alpha lipoic acid, and glutathione blocks the primary pathway of inflammation of the virus, which is called NF-kappa B. So this is a switch inside your nucleus. When this switch gets turned on, that's when these inflammatory molecules come pouring out. So you want to block the switch that is turning on all the inflammatory molecules, this which is NF-kappa B. That is done with NAC, alpha lipoic acid, and glutathione. So that is the primary way that we're blocking the inflammatory response. And after I published this article, a patient I hadn't seen in 7 years emails our office and says, "Hey doc, I just got COVID and I was short of breath. I read your article. I tried 2,000 milligrams of glutathione and I noticed within an hour I was better."
Unbelievable. And that's what I love about you, Dr. Horowitz. You are such a medical detective. You were the one that said, be your own MD, be your own medical detective. And you know what? I keep this around because we are all medical detectives because of what you have empowered us to really look at our body and see how our bodies, it's like, when we buy a car, people know how to run the engine and they're not sabotaging it. They know what to put in the engine. They know to put a gas in it or in the gas tank or in the car. They know what to do so that it runs smoothly, but then yet we don't understand how important our body is, because if we give it what it needs, it will run smoothly. So with that in mind, you've done such great with Lyme, and now you've put in your PI hat to look at COVID-19. And how exciting is this for you to see that this is something that you can treat versus waiting 18 months or whatever for a vaccine.
Right. So, I mean, the problem is, as a physician, when you have sick patients, you can't wait 12 months, 18 months. You have to understand the medical literature. You have to understand the best way to treat your patients. And again, I mean, it's going to be a while until they have, randomized controlled trials on a lot of these different treatments. But the beauty about NAC, alpha lipoic acid, and glutathione is they're nutraceuticals. They're not pharmaceuticals. And these are available over the counter. Now, the only thing you need to know about these is that we usually use alpha lipoic acid up to 600 milligrams twice a day, but rarely, if you're someone with hypoglycemia, with low blood sugar, that's really the primary issue you have to watch for, is that you don't get hypoglycemic, low blood sugars, taking that amount. Although I will tell you, I've been on that amount for probably 10 years, 15 years. I have hypoglycemia, doesn't bother me at all. But over my career of 35 years, maybe 2 or 3 patients told me, I'm talking out of thousands, that they might have gotten a little hypoglycemic. So it's just something people need to know, that you want to make sure your diet is small, frequent meals, adequate amounts of protein, complex carbohydrates, healthy fats. The thing about glutathione is, since your body makes glutathione, it would be very unusual for someone to have an adverse reaction to it. But the only people that I've seen that potentially could have a problem are ones who have multiple chemical sensitivity. So these are the people that are very sensitive to chemicals in the environment. And probably maybe 2 or 3 times in my medical career, I gave them an IV glutathione shot. You run it in over an hour. And some of those people said, I feel a little itchy. I feel like I'm getting a little chest tightness. And that's because they're so sensitive to the sulfa molecules. Glutathione is a tripeptide. It's made up of 3 different amino acids. So you make it up from glycine, which is in your diet, right? Cysteine, which is an amino acid from the diet, and glutamic acid. So your body makes glutathione by taking these 3 amino acids and putting it together. But cysteine, like N-acetylcysteine, NAC, is the rate limiting factor. And that's why it's so important, because if you don't know how much, for example, how many infections your body has or how many environmental toxins you're exposed to, your body uses up glutathione when you're exposed to infections and toxins. So therefore, if you get COVID-19 and you are living in a place that has a lot of pollution, and you've been exposed to PCBs and dioxins and pesticides and plastics and heavy metals, you are using up your antioxidants like glutathione, so you don't have it available to protect your precious lung tissue and your heart and the other organs. So the first step from my standpoint is making sure that people have enough glutathione. And you can measure this, by the way, in the blood. There's a very easy blood test. You can actually measure your glutathione levels. And we have found over the years that people are deficient in glutathione. So
And
this
what
is
is
a
that
very,
test, Dr. Horowitz?
Oh, it's simply a serum test. You can go to any standard laboratory, LabCorp, Quest, BioReference. They will run this test. It's simply a serum glutathione level. Just like you can run a natural killer cell, you can check your immune system status, called immunoglobulins, subclasses, because Lyme patients, for example, some of them are immune suppressed. They can get low immunoglobulin G, which is how you fight infections, or low subclasses, how you fight viral and bacterial infections. So that's also a very easy test that you can do at the laboratory. And when people are sick with this, you do want to know your immune system status. It's important to know, are you zinc deficient? So for example, as we talked about earlier, zinc may be very, very important. It helps these macrophages to kill the virus better, to not have an overstimulated immune response. In fact, they found years ago in nursing homes, if they gave them zinc, this was a double-blind, placebo-controlled NIH trial. This came from the government. They found that in the nursing homes, when they gave them zinc and they got infections, they did much better because they had much less inflammation. So inflammation is the main reason why people get sick with Lyme disease. It's the main reason why people get sick with COVID. Now, the second way we block inflammation is another pathway called NRF2. So when you NRF2,
and
N is in Nancy,
NRF2.
yes, N is in Nancy, R is in Richard, F is in Frank, 2, NRF2.
Okay.
So this is another pathway when your body has a lot of free radicals, oxidative stress, it's under attack. with inflammation, there's something inside your cells called NRF2, and it's bound. It goes into the nucleus and it stimulates genes called ARE, antioxidant response element genes. What does that do? It lowers inflammation. It opens up detoxification pathways. It even helps with cancer. So we give curcumin, turmeric, right? At least 1,000 milligrams twice a day. Interesting that turmeric, curcumin, at doses up to 8 grams, will decrease all the inflammatory molecules with Lyme and COVID are decreased with turmeric, with curcumin. So to stimulate NRF2, we're using curcumin. We're using broccoli seed extract, which is sulforaphane glucosinolate. So broccoli seed extract is one of the most potent stimulators of NRF2. We're using 100 milligrams twice a day. And this will make NRF2 go into the nucleus, stimulate these genes called antioxidant response element genes, and lower inflammation. So we're talking a 3-step approach. Block NF-kappa B, which is what's turning on these inflammatory molecules, with NAC, NAC, alpha lipoic acid glutathione, lowering inflammation by stimulating NRF2 with curcumin, broccoli seed extract. You can also do it, by the way, with green tea. You can do it with resveratrol. Those are the 4 main NRF2 activators, right? And then lastly, get your immune system in shape using zinc, 40 to 50 milligrams a day, a gram of vitamin C 3 times a day, which is higher for pneumonia, and 3,6 beta-glucan, 500 milligrams, for example, per day, up to 1,000. And that gets those natural killer cells able to fight the viruses properly. So this is the approach we've been recommending. And we plan on doing a randomized trial in the elderly population. I just spoke to researchers yesterday, and I contacted the Department of Defense about 10 days ago. There's research money available for COVID. We're hopefully going to do a study in the elderly population because they're dying off like crazy in nursing homes. The nursing homes, I mean, the body bags are accumulating. It's horrific, right? For these people who have their parents in nursing homes, they can't go visit them. They're dying. We're probably going to go after this most vulnerable population first and see if we give them NAC, alpha lipoic acid glutathione, right? Can we protect this vulnerable population? And of course, if it works, then we'll open the study. And of course, it'll then be open label and people will know about it. But it's so interesting that the 30 plus years on Lyme disease, I'm now doing what we call translational medicine, which is in Lyme, you had to block inflammation because that's why people get sick. In COVID, it's the same inflammatory molecules. And lo and behold, glutathione seems to be one of the keys. And when I looked it up in the medical literature, what was fascinating is they found in bacterial and viral pneumonia, as well as in acute respiratory distress syndrome, it's been published way before I did my study that glutathione levels are low. So here we already have published that in pneumonia and ARDS, you have low glutathione, yet not one person in medicine ever thought to themselves, maybe we should try glutathione. Maybe we should see if it helps these people. So this may also be a treatment for ARDS. It's really quite exciting.
ARDS.
ARDS, acute respiratory distress syndrome.
Okay, I just want to make sure.
It's one of the worst complications of COVID-19.
Now, the ARDS, because there was a doctor in New York that came out and said, this isn't a lung condition more than what he saw was a woman that looked like she had been just dropped off the mountain, Mount Everest, without giving her any time to adjust, altitude sickness. What do you say about that? Is that the same thing?
So it's a little bit different. So the doctor you're referring to, who is the emergency room doctor in New York City,
yes.
At the time when he posted that video, one of the things we're finding with these people who have the worst complications of COVID is that they get clots, right? We talked about this earlier. They can get thrombosis, like deep venous thrombosis, and it looks like they're probably getting pulmonary emboli. A study came out this morning from Mount Sinai, New York City, from Dr. Valentin Fuster, and I had actually sent in an article to one of the medical journals, a second article about using heparin, anticoagulation, because that's what you do if you get pulmonary embolus, because you're blocking oxygenation transfer in the lungs, they found that the people who were very sick, who went on anticoagulants like heparin, they were doing better on the ventilators. But the other thing that I think, and this has to be proven, is that there is a drug that they use for altitude sickness. It's called Diamox acetylzolamide. And what this drug does, and I took it, by the way, when I went to Tibet over 10 years ago, I was at 15,500 feet meditating in caves in Tibet. I took Diamox, so did my wife. I took 500 milligrams twice a day. And what it does is it dissociates oxygen, right, from your hemoglobin, so more oxygen is available. So one thing they need to look at, and this has been published in the pulmonary literature, is looking at using acetylzolamide, Diamox, to increase oxygenation while also making sure these people don't have clots. And one of the clues that they were having clots early on was a blood test called D-dimers. D-dimer is a test that it's nonspecific. It doesn't mean if you have a low level that's elevated that it has to be a clot, but these very high D-dimer levels were showing up in the sickest patients. And it's probably because they were getting thrombotic events, they were getting clots like pulmonary emboli, and they weren't getting enough oxygen into the tissues. So using acetylzolamide, sildenafil, which is a drug that raises cyclic GMP, that can be used for people whose respiratory muscles do not have the oomph, do not have the power. So this is another study that the pulmonary doctors need to do, is not just anticoagulation, but using, for example, acetylzolamide and sildenafil. And I have this now in the peer-reviewed medical literature. It's under review right now as an alternative therapy to look at for people who are sick on ventilators.
Amazing. And so for those of you who are watching on YouTube or Facebook, I want you to know that if you type in a Q, you can ask any questions to Dr. Horowitz. This is an opportunity for you to ask the experts and ask your question that's specific to you. So if you write a comment, we may not necessarily get to it during the class, but if you put in a Q, we will certainly look at it before Dr. Horowitz is out of the classroom. So, okay, so I've got so many questions for you, Dr. Horowitz, as you know I usually do. So I want to go back because we were talking about, you know, the people that are showing up have a lot of inflammation. The people that are reacting, because I believe that I've been exposed to it time and time and time again, but because my immune system is good, or because maybe I'm healthy, maybe I don't even know about it. Or maybe I get a little sore throat and I take some vitamin C and I'm good the next day. And so with that in mind, what I'm hearing time and time and time again, because I had mentioned vaccines a little earlier ago, one of the things that we're talking, that I'm hearing out there and that people are presenting evidence. And yesterday in the classroom, we talked about how you can't argue facts, right? But lately we're seeing some studies that are shown as facts, but are very manipulated. And so with vaccines and also ACE inhibitors, I'm hearing that some of the accelerating agents in these products are causing that cytokine storm, that's causing that inflammation. Can you address any of that, or do you know anything about how these things that are entered into the body can alter how the body responds?
So there are blood pressure medicines that we've had for years that are very protective actually for the body. They're called ACE inhibitors and angiotensin receptor blockers, or ARBs. These are actually wonderful medications. They protect diabetics' eyes from diabetic eye problems. They protect the kidneys from diabetic neuropathy. People on congestive heart failure, their heart doesn't pump. They give them ACE inhibitors, ARBs, their function gets better. I've used these drugs for years. They're very useful. Now with the virus, they found that the virus enters the cell using ACE. So using these receptors, the ACE receptors. So one of the questions that came up early on is whether it was either beneficial or it was detrimental if people were on ACE inhibitors or ARBs. So the American College of Cardiology came out and they looked at it, and I just saw a recent study on it. There is no reason for anyone to stop their medication for blood pressure who are taking this. And in fact, yes, it does enter into the body through these pathways, but just because you're blocking them, in fact, you might have thought it actually gave a preventative effect using an ACE or ARB because it's blocking the receptors, but it's not true. So in other words, it's an entry point for the virus, but it doesn't matter, honestly, whether you're taking these drugs or not taking them. The viruses are going to get into the body anyway. So the suggestion is if you're on blood pressure medicines and taking these drugs, do not stop them because that could be dangerous.
Okay.
The second question you're asking about vaccines, there are 14 vaccine trials that are ongoing. Now, here's the problem. No one has ever succeeded in the history of medicine to do an RNA virus ever, because the problem is the virus mutates. You know, the problem even with the flu vaccines is by the time they get the H1N1 vaccine, the flu vaccine may be 30 to 50% effective because the virus keeps mutating.
Correct.
Well, the problem with COVID, and I'm going to repeat the numbers so you can hear this, there are 104 different strains of mutations of the virus. 104. They just found out yesterday, I just read the article, that there are certain strains that are self-selecting. So the initial strain that came out of Wuhan is not the strain now that is now starting to propagate. There's actually a much more highly infective strain that is now starting to go around, which is why you're seeing this spread like wildfire during the pandemic. Now, what they are finding, and again, this is going to be interesting, they're looking at monoclonal antibodies. They're looking at taking antibodies from people who have responded to the virus and giving it to people. And actually, there was just an early study that it may be useful. Okay. So, you know, we want our body to make antibodies, right? We want it to make antibodies against the virus. But here's the problem. The people in Wuhan, China, when they made antibodies, there are two types of tests for COVID. One is antibody. The other is PCR, polymerase chain reaction, which is a DNA test. That's the one they do the nasopharyngeal swab. The problem with the antibody tests is that they're very unreliable. So you miss about 20 to 33%. And the FDA has not, you know, there's so many companies doing it. We don't even know. It's like the Wild West out there. And the FDA just gave the labs 10 days to prove that their test is reliable because we don't know whether when you get a positive test or not, what it means. Now, the PCR, on the other hand, is more reliable. So really, if people want to know if they've been exposed, the PCR, this DNA test, is more reliable. But here's the problem. So in Wuhan, they got sick, they made antibodies, and they turned DNA PCR negative. They were asymptomatic. They said, okay, you can now go out of your homes and go back to work. Every 2 weeks, they followed these patients, and 13 to 14% of them reactivated the virus. The virus came back even though they had antibodies. Now, what's happening here? So either the antibodies are not effective in controlling the virus, or they're effective enough in your own body in controlling it, but then you are going to be transmissible to other people. So you're not going to have symptoms. In fact, a woman yesterday that I treated had emailed me and said, Doc, I'm over it. I have no more symptoms. I treated her, but she's still PCR positive, meaning the virus is still hanging around and she could be infective to other people. So,
but is that real? Can you have a virus inside of you that's inside of you and jump into somebody and activate them?
Well, through your respiratory air, through the air, through respiratory droplets. I mean, that's how it's normally transmitted.
But has that been proven? Has it been proven that that theory is correct? I mean, I know that that's what they're telling us.
Yes.
But has it been proven?
Well, I mean, normally that's as far as everything I've seen, that's the major mode of transmission. I mean, it's on surfaces for 12 hours, 24 hours. It depends on its cardboard, stainless steel it can survive on. But the main way that it's getting into the body from everything I've seen is through the air, through respiratory droplets. And the problem is they're saying social distance 6 to 8 feet. But here's the problem. The Italian researchers have looked at this and have found that the indoor environments may actually be one of the most highly transmissible areas where people are like pushing it back and forth. And also it may be transmitted on what we call parts per million. There's very small particles in the air that they call 2.5 or less than 2.5 parts per million. These are, by the way, the particles they've shown that have been associated with Alzheimer's disease. When you inhale this through your nose, they are basically causing an inflammatory response in the brain. Some of the Italian researchers, this still needs to be proven, were finding the virus on these very tiny particles in the air, meaning 6 to 8 feet may not be enough to stop the spread because this thing is basically all over. So, again, this all needs to be corroborated by other researchers. But there are questions on this, but I believe that's going to be one of the major problems. Is it may be highly transmissible with this new strain. It may be not, 6 to 8 feet away may not be the answer. And the antibodies that we form may not be protective enough, which means we're going to have our immune system be able to fight this. And that is why this three-pronged approach I was discussing with zinc, vitamin C, beta glucan, NRF2 activation, curcumin, broccoli seed extract, blocking NF-kappa B with NAC, alpha lipoic acid glut. I think this is going to be the major way, but there may be antivirals. They're repurposing old drugs, and the ones that I've actually find the most interesting is a drug called ivermectin. They gave this to people on ventilators. The ventilator rates of death have been horrific, like 88%.
Yeah.
They gave this drug in
They're
high
actually
dose.
saying, I want to add, they're actually saying that people aren't dying of COVID. They're actually dying of the respirator.
Well,
Or
the problem
ventilators.
is the respirator protocols they were using, they were pushing too much air. They were thinking, okay,
Yes.
we've got to use more pressure, right? PEEP and pressure to get it in. But the problem is if they had pulmonary emboli and they weren't getting oxygenation, the answer is not pushing it through lungs that are already damaged by the virus with ARDS, right?
Mm-hmm.
So I think they are now adjusting the respirator protocols. But the point about all of this is that the antibodies, if they're not effective, ivermectin, they used it in a high dose and there was much less deaths, much less mortality with one dose of this drug. It's an anti-parasitic drug that the WHO has said is like one of these really essential medications. And another drug that was used for SARS and MERS, which are coronaviruses we had years ago, is Alineo or nitazoxanide. I've also used this in treating patients. So my approach is use an antiviral that they're looking at. And by the way, they're looking at Pepcid. They're looking at famotidine. They're looking at Singulair, which is it's a medicine I take for my asthma.
Yeah, that's right.
I mean, they're by the way, even curcumin, the herb that I said that affects NRF2, there's a study that got published on herbs on natural medicines and found that curcumin turmeric is a protease inhibitor of the virus. It inhibits one of the enzymes in the virus, just like melatonin. Melatonin looks like it may be useful because one of these inflammatory cytokines, interleukin 18, which comes from inflammasomes. You were talking about earlier about exosomes.
Mm-hmm.
Inflammasomes is one of the ways you get this inflammatory response in the body.
Mm-hmm.
They found that melatonin will inhibit some of these inflammasomes and inhibit interleukin 18, and this was published. This is not just me talking about it, it was published in a
but
recent
nobody's
study.
talking about this stuff, but you and I, nobody's talking about all these things and all these solutions. It's all about, how many face masks have you ordered and how many this have you ordered? How many ventilators are there? It's insane. These are the things. And I want to add here because I do. And Dr. Horowitz, that I love honoring my sponsors. I want to encourage all of you who are watching and who will watch later on to please go to whenyouneedafriend.com. Some of these conversations that we're having, even as simple as what we're having today, are being taken off social media because they're calling it not valid information. And here is Dr. Horowitz, who is highly, highly credentialed, a friend of the show, of the classroom, a teacher in the classroom who I absolutely adore and trust. Here's someone who has gone beyond what medicine has been able to do for Lyme disease sufferers. And so I want to take a moment to ask you to please subscribe at whenyouneedafriend.com, because if all of a sudden I'm no longer here, you need to find me. And that's where you find me, at whenyouneedafriend.com. While you're there and when you subscribe, you get all sorts of gifts on the 90-day challenge to self-love ebook and meditation that's kind of old, but it's okay. It'll get you started if you haven't done a meditation. And also while you're there, make sure you like and follow me on Facebook, subscribe on my YouTube channel. And now I have BitChute. And I need all of you to go to BitChute become a member of BitChute. I guess that's what you do, just like you are a member at Facebook or YouTube, and then subscribe on Lillian McDermott Radio Show Classroom. So that is where you can go to if, well, all of a sudden you don't see any videos or anything there. At least we know where to meet again. So that's what we do. And so so while you're there also, I need for you to check out my sponsors, because without my sponsors, there would be no class. And one of the things I'm really excited to Nori, which is our newest sponsor, and they have a broccoli sublingual tablet. It has broccoli and radish sprouts. And so this is Nori Nutraceuticals, and it's part of the Nori brand. And I'm really excited. I've been doing the broccoli sublingual, and it's been absolutely phenomenal for me. So they're one of the sponsors, so you can check them out. We have Keep Me Safe Organics, that is keeping pesticides and chemicals out of your body and your skin. First Alternative Care, we have the pharmacy in Merritt Island, Live Longer Medical, and of course we have our affiliate sponsors like Ground Therapy, that helps remove inflammation in the body, and Brain Tap, which you can go to Brain Tap and get a 15-day trial for free, where you can listen with your earphones. You don't need the headphone. You can enjoy this meditation, because we're going to talk a little bit about fear in a little bit, and what we are dealing with right now, with a lot of fear mongering as well. And so please go to whenyouneedafriend.com, support my sponsors the way they're supporting the classroom. And also you too can become an enrolled student. You can become an enrolled student by donating $1 a month or $20 a month, whatever you can help with, it will be helpful. And you can also spread the word about the classroom, donate your time, whatever it is. Please help us grow the classroom. Now we have some questions, Dr. Dr. Horowitz, I know how busy you are, so I'm so grateful to you. I want to encourage all of you to go to cangetbetter.com. You can also get this book. It has all these do-it-yourself where you can do your own testing, and there are a lot of labs that you can go to and demand that you get this without even a prescription from a doctor. So be your own MD medical detective, which is a quote from Dr. Horowitz. I loved quoting that since you've been in the classroom many years ago. Now, Dr. Horowitz, the question we have in the classroom in Facebook is wearing a mask helpful?
So I've seen actually the YouTubes. I know what they're describing. And the thing is the truth is I don't know. Because when I've looked at the transmission of the virus in the indoor environments, and I've looked at the Italian study on this parts per million I was just discussing, it means that pretty much with an infective virus like this, especially with the strain going around, it's likely that just about everybody's going to get exposed at some point in time. So, you know, the thing is unfortunately, not everyone is practicing social distancing. You see this in, you know, the kids in Florida on the beaches, they just can't take it anymore. The governor opened it up. But, you know, the problem is New York's been hit very hard, you know, so we're of course being much stricter here, but in other states or in more rural areas, they may not be as strict. And the problem is there's probably going to be outbreaks in hotspots. So, you know, my perspective is you have to assume you're going to get this. And therefore, assuming you're going to get it, you want your immune system and you want your antioxidants in your body to be able to handle the onslaught of the virus, because it looks like that's the main reason that people are getting sick, is this inflammatory response, just like Lyme disease. And again, that's the beauty of what we call translational medicine, is that what I learned from Lyme disease all of these years can now be applied to COVID-19.
And exposure. Okay, you were talking about the kids on the beaches of Florida. Well, DHS came out with a study that, you know, being out in the sun kills bacteria, and being out in the sun, breathing the real air, that is helpful to us. And, you know, when we have a little bit, if we get exposed and our body can handle it, then we build our own immune system up so that we don't, it becomes a severe issue with us. What do you say about that?
So the difficulty is, in the past, these type of viruses, like when we had the Spanish flu in 1918, and we've had pandemics, or the flu virus, the rule of thumb normally is the virus goes away in the warm weather. Ultraviolet rays with the sun, normally, this is what President Trump actually was, you know, what he was describing actually a week ago, whatever, it was actually ultraviolet usually does kill viruses, except in this case, they've not shown it to be the case. In other words, they expect this virus is going to be around this summer. Normally, we were hoping there was going to be less cases, and that, of course, may still happen, but they're expecting another peak in the fall. So, the thing about this is we're not going to be able to wait, at this point, even if a vaccine becomes effective, even if it's safe, it's going to take a long time to get it, and we don't have time. We have to do something to protect ourselves and our loved ones now. And that's why I think looking at the literature on glutathione, on how to block inflammation, on how to protect the body, these are the things I'm advising my patients and anyone listening, speak to your healthcare provider, about these type of things, assuming they do natural medicine and know about it. And, I do describe, by the way, in my book, I describe glutathione and NAC and alpha lipoic acid for cytokines. So again, I mean, all of this is described in there, including broccoli seed extract, sulforaphane and the rest. So
Yes.
it's just taking something from another disease and moving it over.
Wonderful. Okay, so we have a question from YouTube from Chris. Thank you, Chris, for your question. And they want to know what you think about Dr. Brownstein's protocol. I don't know.
I had seen out on the chat, and I think what they were discussing was the mask issue that we were just talking about, unless there's another protocol that I'm not aware of at this point.
Okay, so if you want to be a little bit more specific about the mask, if it's a mask protocol, and I believe that those, did I get all the questions, Robert? Thank you so much for keeping me aware of the questions. While Robert is letting me know if I got it, I wanted to ask you about testing, because testing seems to be like the #1 question that they're asking out there. How many tests did you order? How many tests? But just recently, I don't know where, and you probably know where it was. They did a test with a fruit and a sheep, and both of them came out with COVID-19. So what can you say about testing at this point?
Well, so as I was describing earlier, the antibody tests are not highly reliable. And unfortunately, there's so many antibody tests out there that are not FDA approved. They've not gone through the proper validation, that you can't really rely on it. So there's 3 types of antibodies: IgM, which is normally early, IgA, and IgG. So I recently just tested myself with IgA, IgG, just to see if I had been exposed. It turned out I was negative. I thought, this virus was around for a month before anyone knew about it, right? So odds are a lot of us did get exposed to it. But really the test, if you think you're exposed, and I want to go through the symptoms with people to know, really the best test is the PCR, the nasopharyngeal swab. And there are drive-throughs now. These emergency places have kicked up. There's drive-throughs. So the symptoms you're looking for is having fevers. They can be low-grade fevers, 99, 100. I've seen it up to 103. You can get chills, shaking chills, just like I see sometimes with babesia, with night sweats. People will get a cough. A lot of times it's mostly a dry cough, which is non-productive. People have described shortness of breath, like a tightness in the chest. But the hallmark symptom in 88% of the people is losing your sense of smell or taste. So that is really a hallmark symptom. It's happened before, for example, in neurodegenerative diseases like Parkinson's and Alzheimer's. That is one of the earliest symptoms when you get a neurodegenerative disease, is losing your sense of smell. But it's an early symptom of COVID. We see diarrhea. We will occasionally see nausea, vomiting with abdominal pain, right? So those are probably the most common symptoms. And rarely you will even get brain fog and memory issues. And unfortunately, some of the worst cases, there's a disease that's come out of COVID called A&E, acute necrotizing encephalitis. And this is basically people that have had very severe viral inflammation in the brain tissue. Some have had strokes from it. Young people have had strokes, again, I think from the thrombotic events. So, if you are having any unusual neurological symptoms, you need to be evaluated by a neurologist immediately to see whether you're going to be at risk for a stroke and whether anticoagulation is going to be necessary. But these are the symptoms you're looking for. And if you think you have it, don't just get an antibody test, get a PCR, because that is the most highly sensitive test right now. And honestly, you would start treatment if you didn't know and you let's say, had to wait for the test. People can become very sick very quickly with this. They can turn around.
but being proactive and taking zinc and vitamin C and all these wonderful things that you're describing are a way to help ourselves too.
Absolutely.
Okay.
Absolutely.
So, with that in mind, I know we only have 5 minutes left in the classroom, and we didn't even talk about hydrochloroquine, but I do want to talk about fear. I know New York has had it really, really bad. There have been a lot of things that have been blocked in New York, like some of these remedies that you're discussing, that doctors are just saying, we need to do something here. We can't wait for a vaccine, and the vaccine may not be helpful either. And so let's talk about this fear that can cause a lot of issues in the body.
So you're absolutely correct. And I actually wrote something on Facebook and posted something a while ago on this, that, there is a pandemic of fear, just like there's a pandemic with the virus. And unfortunately, you want your immune system to be in tip-top shape to deal with the virus. And what fear does is fear lowers your immune system's ability to fight.
Exactly.
So it's certainly understandable for those people who are not used to, for example, Buddhist training of impermanence and, living my life one day at a time because I don't know when my next day will be. For those of us who've not had this kind of 40 years worth of lamas telling us this, that live it one day at a time because you never know, it is very scary, especially if you don't have a philosophical and a spiritual system, that you realize that you're a human being having a spiritual experience. There's the soul in the body, and there is no such thing really as death. There's relative death, but there's no such thing as ultimate death because consciousness lives on.
Mhm.
That's my philosophical hat for the day on that one.
I
But
love it.
so
And we've
but
done a lot of classes on that too, because COVID isn't just for the body. I mean, it's a spirit, mind, body approach, and that's what I love about you. There are so many things I love about you, Dr. Horowitz, but the fact that you look at the whole body, spirit, mind, as well as the body, because if you're healing, if your spirit and your mind are in alignment, that what you're talking about, the body can be fixed pretty easy.
So this is a time for those who do not have a meditation practice. This is a time to get one. Now, in both of my books, in the last chapter, I have passed on the meditation teachings from my Tibetan Buddhist lamas. So this is not like I read it in the book. These are direct oral transmitted teachings on not only how to meditate and calm the mind, but ultimately how to reach awakening. I have put, one of the things I like to do is take 35 years of Buddhist practice and put it into a chapter so that you've got kind of the essence of it. And it is described in the back portions of my book. And I plan on doing Zoom webinars very shortly.
Well, let me know. Yeah.
So I'm going to start doing Zoom webinars for meditation for people online, to teach meditation, to help them with it, because definitely there's a pandemic of fear, and we need to learn how to transcend the fear, how to look the fear right at it and see that it's empty. It has no color. It has no form. If you look at your mind when fear arises, and you calm your mind and have your awareness look at its own awareness, and you say, okay, where is this fear? Where does it come from? Where does it go? Does the emotion, the thought of fear, have color or form? This is called insight or Vipassana meditation. You'll see that you can never find where fear comes from. You can't find where it goes. It has no color or form. So it's not that our body won't react as if it's real. But the reason for these meditations right now is you must learn to live in the present moment and not in the future, which is where all fear is. So the mantra is be here now, right? Be here now, open to your spiritual guides, love as much as you can through your heart. Now is your time, right? To have compassion for these sick and suffering people. Love and compassion kind of is the rudder for the ship for everyone right now. And that's how we're going to get through this and get to the highest point that we can as a country and as a world.
I love that. Thank you so much for that inspiration. Yesterday we did a class with Jason Stevenson. He does the Jason Stevenson meditation on YouTube. And we did a Ho'oponopono meditation yesterday, which was so wonderful and so uplifting. So I want to encourage all of you who have tuned in today or will be watching later on to check out some of the other classes that Dr. Richard Horowitz has been on, where he has enlightened us about different issues, not just Lyme disease. And I know that, we were planning on talking about, bringing Lyme back up so people can be aware, but I'm so grateful that you've done your research about COVID-19 and that you were ready to help us take our health back and start being proactive so that we can build our bodies so that when we are encountering a virus, our body will fight it naturally.
And just know, because May is Lyme Awareness Month, the ticks are out. They're very small with the nymphs. Protect yourself. Protect yourself.
Protect yourself. Okay, so for those of you who are listening on podcast, we do have a teacher's pet call afterwards, so you can always tune in and join us on Facebook and YouTube. And please remember that you have the power to heal. This is Lillian McDermott and Dr. Richard Horowitz wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Yay. Okay, so we're going to continue. I have some questions for you.
Very good.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.
So Chris came back and said, I want specifically to talk about the protocol of vitamin C and nebulizing vitamin C and iodine and hydrogen peroxide.
So I don't have a lot of direct experience. I mean, I know some alternative integrative doctors use hydrogen peroxide. They'll even use it in Lyme disease like ozone. These are oxidative stress therapies as opposed to antioxidants. These are oxidative stress. I don't personally have a lot of experience using it, so I can't really comment much. The nebulized forms we use actually, though, I'm not sure about nebulized vitamin C, but nebulized glutathione. So there is a way of getting glutathione directly into the lung tissue. The problem is the stuff smells and tastes terrible because it's sulfa. It's like, inhaling rotten eggs. So I think there's probably like better ways to get glutathione in your body than nebulizing it. But for some people, that may actually be a way if the lung tissue is directly affected, apart from using oral or IV forms of it. And IV, of course, vitamin C can be given. There's studies in China that they're looking at IV vitamin C right now. It's been around for a long time. A lot of the integrative docs have used it. Again, in my practice, I don't because of certain regulations in New York State. But I think that, I've heard from patients who've done it, and certain patients definitely have found that it is useful for Lyme. It has antiviral properties. There's 64,000 plus articles published in the medical literature on vitamin C. It's not like there's a dearth of articles on vitamin C and the kind of things we were talking about today.
Yeah. I did that before when this whole thing started, the rumors that there would be a shutdown and all the social distancing. My father had surgery and I stayed with my mom and dad at the time in their assisted living facility. And there were people there with a common cold, coughing on me and sneezing on me. So I called my friend from Live Longer Medical, Lisa Geyer, and I said, I need a vitamin C IV. And she loaded me up with a nice little concoction. And I've been great. And so I continue to take zinc. I continue to take vitamin C. As you know, you and I have talked about how I stopped using all my asthma medication that I had since I was born. I had every single, you can imagine, I was on Xolair for 9 years until when the student is ready, the teacher appears. When I discovered the miraculous, I don't know, I wouldn't call it a cure, but how wonderful vitamin C is. And Dr. Andrew Saul was the one that said, I can get you off all your medications if you're willing. And so I got off of all of it. And what I use is vitamin C. I use Lobelia, and that has helped me when my system is compromised, I'll up it. I'll up the vitamin C. I'll up, the zinc. I'll up, but it's good to know the 3,6 beta glucan. Where do you find that?
Oh, it's over the counter.
Over the counter.
Yeah.
Most of these are over the counters.
They're all over the counter.
Yeah.
All of these are over the counter.
It's amazing.
You just want to make sure you're finding companies that are GMP certified, that are good manufacturing process, that, make sure there's no pesticides and heavy metals. I mean, you just need to do your homework and whatever brand that you're going to be using.
Yes, yes, I make sure that that's very important. Anything that you would like to add about Lyme awareness before we go today? Because I know that that is your heart. You've served in Washington to help with the team that was helping um, bring
Inform
this.
Congress.
Yes, in Congress. Yes. So would you like to say anything about that?
Sure. I mean, so just briefly, so the ticks are out, the nymphs are out. They're very small, difficult to see. It's very important that people, when they go outside, that they do tick checks. You should always carry a tick removal device on you. There are many ones that you can get.
Mhm.
But it does make sense to use a permethrin spray on your clothes. It's a chrysanthemum-based product, and you take your clothes outside and you spray it. It will kill ticks. And then you can use products like IR3535. It's an amino acid base. It's been proven to even be safe in pregnant women in Europe for 35 years. This can go on the skin. Avon makes one. There's a lot of different companies, IR3535. So that's on the skin, or picaridin, which is another one that's on the skin. And in my opinion, these are safer than DEET. DEET got a bad rep years ago, mostly because of seizures in young children. So I generally would prefer using IR3535 or picaridin on the skin. DEET would only be if you're really going to be in deep woods and you've got a really high risk. And even then you can come out, you can shower it off, take glutathione to detox your body. I mean, there's ways of doing it, but people need to realize that these ticks are now containing multiple organisms, not just Lyme. There's relapsing fever, there's Borrelia miyamotoi, there's anaplasma, Ehrlichia, Rocky Mountain spotted fever, Babesia, Powassan virus. They're finding that this virus, which is in ticks and in highly endemic areas like the East Coast, the Midwest, and Wisconsin, 10 to 16% of the people who are living in these areas are now being exposed to the Powassan virus. And 10% of those people, if it gets up into the central nervous system, die from Powassan encephalitis. So these ticks are a cesspool of bacteria, parasites, and viruses. So, you know, especially during the time when you are exposed to COVID-19, you certainly don't want to be exposed to Lyme disease and these co-infections because they can be deadly. Ehrlichia, anaplasma, Rocky Mountain spotted fever, Lyme, Powassan, they're all potentially deadly. Now, fortunately, not that many people do die, but it can make you miserable for a long time. And of course, the earlier you treat it, the better it is. So, you know, if you get any symptoms at this time of the year of, you know, body aches that you can't explain, and again, this could be Lyme versus COVID, muscle aches, joint aches, fevers. But the hallmark of Lyme is that there is migratory joint pain, migratory muscle pain, or migratory nerve pain, tingling, numbness, burning, stabbing. So even though some of the symptoms of COVID could overlap with brain fog and neurological issues, Lyme doesn't usually cause a cough or shortness of breath, but Babesia does. Babesia, which is a parasite inside the ticks, will cause a cough and shortness of breath. And in the past, when I treated people for Babesia shortness of breath, guess what I used? Glutathione. And glutathione would help these people who had shortness of breath from Babesia, from these cytokines, from these inflammatory molecules. So, you know, the thing about Lyme Awareness Month is just realize it's out there. You know, be preventative, think about it, always check for ticks when you come inside. You can put your clothes in the dryer at, you know, high heat for 10 minutes, which will dehydrate and kill the ticks. But know the signs and symptoms. They're in my book. They're in How Can I Get Better? There's a questionnaire that is validated statistically in that book, How Can I Get Better? And if you score more than 63 on that questionnaire, you have about an 88% chance of being exposed to Lyme disease.
Wow.
So if you have that constellation of chronic fatigue and muscle and joint pain or nerve pain that's moving around, memory concentration problems, word finding problems, I can't remember people's names or phone numbers, I walk into rooms and I don't know, you know, why I walked in, can't fall asleep, keep waking up in the middle of the night, I'm depressed, I'm anxious, all of a sudden I have OCD and I never had it before. Lyme will cause that constellation of symptoms. That questionnaire in my book is very helpful because it has been validated in 1,600 people. It's been published in the medical literature. So the Lyme tests are not reliable, at least the antibody tests right now, they're not great, just like for COVID. So you need to know the symptoms, and you could take that questionnaire in my book to figure out if you have it. And then I discuss a lot of the newer treatments. My wife is now 2.5 years symptom-free from Dapsone, from doing 2 months of an antibiotic protocol, just 8 weeks. She's now going on 2.5 years completely symptom-free.
Wonderful, wonderful. It's amazing the work that you're doing, Dr. Horowitz, and I'm so grateful that you've taken the time, as many times as you've been on, to share your wisdom with all of us. And I want to encourage all of you to go to cangetbetter.com. That's his website. And when are you going to start doing your Zoom webinars?
I just got the Zoom account actually 2 days ago. So I'm going to start playing with it a little bit, making sure, I understand how to do it, because there is a way to do Facebook Live as you're doing. And then I'll probably send out a message. It'll most likely be on my Facebook page.
Okay.
So for people that are interested in the online Zoom meditation, where I'll pass on these techniques that I've learned from teachers over 40 years. And these are, I can't say enough of how wonderful my teachers are. I've been blessed by having many enlightened Tibetan Buddhist masters. I didn't even know who these teachers were. I started training them in Belgium back in 1984, when I was in my fourth year of medical school in Belgium. I started training with them then, not even knowing who they were. And I had really the great privilege of training with some great masters. I took extensive notes, learned this. I've been practicing now for 40 years. And it's really a perfect time for people to learn meditation. It is not difficult, not at all. Whatever you have heard about meditation, it is simple, but you just have to learn the 3-step process that my teachers have taught to me, which is calm abiding, first learning how to calm the mind and stay in one place, then insight or vipassana, once you can stay in one place and your mind's not roaming around like a wild elephant, then actually looking at what arises in the mind to see its nature. And the last stage, which is called Mahamudra, which is the final stage, which is actually very easy for Westerners, which is actually learning how to look at the mind and its nature. And now is really the perfect time, because we're being forced, to look at our minds because of the fear, because of the worry. So now is the time for those people who don't have a meditation practice to learn it. And what's beautiful, it transcends, religious boundaries. Like what I'm teaching and what I'm going to share, it's applicable whether you're Jewish or Christian or Buddhist, or it doesn't matter, because I'm going to talk about working with the mind, and the elements of loving kindness and compassion, right, are elements in all religions, right, of how they're being taught. So it's something that's really applicable to anyone, whatever their religious beliefs.
Well, and the name of your Facebook page again?
It's Dr. Richard Horowitz.
That's right. Dr. Richard Horowitz. Go and check him out. And I'm going to sign in so that I can get a notification for your Zoom, because I am so intrigued about meditation. And I've been working with BrainTap because it helps me because it uses all these bells and whistles. It uses lights and infrared for the ear and binaural beats and isochronic tones and all of that. And I'm like, okay, I don't have to worry about doing all that stuff. But I think I'm ready to kind of do this more of a gradual, where I feel empowered to just sit in silence and be okay with it. Dr. Horowitz, I do want to talk about real quick, because I know I want to be sensitive to your time. I do want to talk about HCG, hydroxychloroquine. Yeah.
So, the thing about hydroxychloroquine, I think it's gotten a pretty bad rep for honestly, for no good reason. The French study of Didier Raoult, he at that point had seen over 1,000 patients. It's true, it wasn't controlled randomized. I mean, it doesn't meet the highest standards, but about 92% of the patients did very well. Their major concern for this drug, especially with Zithromax, which was what we used in their study, is that it can affect the electrocardiogram in certain people that are sensitive, that they can get heart arrhythmias. The ones that would be most at risk have what's called a QT prolongation on the cardiogram.
Mm-hmm.
Now, I've been doing medicine for about 35 years, and I've only found 3 people who have ever had a QT prolongation. And of course, we avoided these drugs. But they're talking about Plaquenil, hydroxychloroquine, as if it actually causes a lot of QT prolongation. I've used Plaquenil in over 10,000 people. I've never seen it happen. Now, Zithromax, on the other hand, yes, I mean, it's known. So, I think there is a bias at this point against the drug. It looks like as a preventative. This drug's been around for 50, 60 years for lupus and rheumatoid arthritis. It's very safe. After 10 years on a standard dose, you have to make sure that your eyes are okay, that you're not getting retinal deposits where you might have problems with color vision. That's really the major side effect. And by the way, that's never happened to one patient ever in my practice, giving this drug to thousands of patients for years even. The drug is very useful. So I think they're kind of overstating the case of how dangerous it is. And I think from what I've seen, it may block the viral entry into the cells. It's not an unreasonable drug to be trying, but again, they are going to need randomized controlled trials to see. But I think they've overstated the case.
Well, there was one in by the NIH. They did it in 2005, and they concluded that it was good.
Yeah,
back in 2005. But I guess
we don't know against COVID. But the problem is we don't know against COVID, right? What it's exactly doing. And they're trying. Look, I understand that they're trying to uphold the highest level of science, but in the middle of a pandemic, when you don't have randomized controlled trials, and there's literally 10, 15, 20, 30 articles per day that are being published on COVID, right? And mine was one of the, hundreds and hundreds that are coming out. It's difficult to keep up with it. I mean, I'm reading hours per day as much as I can to keep up with it. I don't think it's an unreasonable, therapy for people. But again, we're going to have to look at an antiviral, and I don't know yet if it's going to turn out to be a natural one, if it'll turn out to be ivermectin, 1 dose a week. I don't know what the right answer is yet for it, but I know that we're going to have to figure out with these people that are reactivating the virus, even when they're antibody positive, we're going to have to figure out how to have either natural antivirals or plus a medication that is a safe, effective medication. We're going to have to figure this piece out because it's a while away from getting a safe and effective vaccine. And again, I don't know that they're going to have enough time to do really safety studies on this. They're looking for volunteers right now, but they've never, in history of the vaccine trials, they've never been able to do an RNA virus like this, especially in such a short time. So it'll be a miracle if they can do it. God bless them if they can do it, but it's got to be safe, right? And that's really the key, because otherwise you're going to want to know how to basically keep your own immune system and how to lower the inflammation, right? Keep it strong, because that's what every American, every person living on the planet is going to have to do to protect themselves and their loved ones.
Well, I think you've given us a lot of food for thought, and this reactivating the virus in your body could be as simple as what you said, meditation. Could be as simple as bringing that peace within us so that it's not reactivated from our own anxieties and fears that can be tamed through practices that are healing practices.
No, I mean, your immune system will definitely be helped by meditation. There's studies that have actually been published on it. But I will tell you, this virus is, it's not like the normal viruses we've dealt with. I won't go into the questions of how the virus originated. I'm not going there on this one.
We're not going to go there.
We're not going to go there. But let's just say that it is highly infective. It is very powerful. They've never seen thrombotic events like this in viruses before. I don't ever remember seeing it with SARS and MERS. So people have to realize that this is really a deadly pathogen. You really need to pay attention to this. But at least from my perspective, with everything I've read, lowering the inflammation, getting up your glutathione pathways in the body, right? Stimulating NRF2, using zinc, these are natural things that, speak to your healthcare provider, because I do think this is going to be the most probably easiest and effective way of protecting people during this pandemic. So, hopefully that will be of help for people who are listening.
This pandemic, and I'm sure that there's going to be more. I mean, every year we get the common flu, we get the common cold, and perhaps maybe this will be another benefit of your research. So thank you, Dr. Horowitz, for everything that you do. You are absolutely amazing. So we will see you soon, okay?
Thank you, Lillian. It was really a pleasure being with you today. Stay safe.
Take care. You too.